Coming to you from the podcast studio of WTAP+. This is your quick guide to today's health questions and your connection to real-world health tips. You're watching Keeping It Healthy.
Hi, welcome back to Keeping It Healthy podcast. I'm your guest, Stephanie Plant, and I'm here with my guest, Dr. Miranda Dunn from Bowling & Dunn. Welcome to the podcast.
Thanks for having me.
Yes, thank you for being here. So it is Dental Health Month here in February, so we're going to talk about all things dental and how that affects the health.
Okay,
all right,
great.
Perfect. So let's start off by first, what drew you to dentistry? Walk me through, what that looked like for you.
Well, I actually said there was no way in hell I'd ever be a dentist, but my dad, Wayne Dunn, is a dentist and had a practice, so I was around it growing up, and I did not plan to ever do it. I had planned to do veterinary school, and then I decided I hated to see animals suffer, and then it changed to medical school, and then one summer, in between college years, I wanted to buy a dog, and so I started working for my dad as a dental assistant just for the summer to earn money to buy this puppy, and I ended up really liking it. So that's how I got here.
That's how you got here. So, and how many years have you been practicing?
You're asking me to do math.
I am asking you to do math. Yes, I'm sorry.
16 years.
16 years.
Yep.
Yeah, very good. All right. Yeah. So, can you walk me through the path from dental school to where you are in your current role today?
My path was sort of twisting and turning and convoluted. When I was in dental school, I did some externships with the Indian Health Service. So I was able to go to Indian reservations in Minnesota and do some work with the IHS. Right after school, I went into private practice in Western Maryland. Then I made my way to Kentucky to corporate dentistry, and then decided to come back home. Come back to Parkersburg.
Yeah, so, and then you joined the practice with your father at that point in time?
I did, at 2014. Yep.
2014, yeah. So, and in the practice, you have how many dentists over there? You want to introduce the dentist?
Yeah, we have, so my dad is the founder, Wayne Dunn, and then we have Dr. Bowling, Dr. Jason Bowling, Dr. Michelle Lynch Bowling, and myself, and then we have a recent graduate, Dr. Sydney Harris. She is a local girl, and she graduated last year from WVU and joined us, and she's fit right in. It's worked out really well, and people really, really love her.
Yeah, it's great. Great. I've had the opportunity to meet her. She is great. Mm-hmm. She's got a great personality.
She does. She does. She fits right in.
Yeah,
yep.
Yeah, very good. So what are the top 3 myths about oral health that you would like to share?
There's so many myths about so many things, right? And in the age of social media, we're in a place where 30% of their people get their news from TikTok or Facebook. So there's really been an attack on science, an attack on facts, an attack on just different truths. So that extends also to dentistry. I would say for older adults, one of the common myths is that, I have a hip replacement, I have a knee replacement, my surgeon told me I need to take antibiotics forever and ever and ever. And, many years ago, those recommendations changed. They determined through further research that there's really, no further increased risk of having a joint infection than, either way, whether you had the antibiotics or whether you didn't have the antibiotics. And so one major factor in the decision is that antibiotic resistance is a public health, epidemic. These older Americans, they're getting sick, they need to be in the hospital, they need antibiotics, but there is no antibiotic that will work for them because they're resistant from years and years and years of just taking antibiotics all the time for various things. So the risks outweigh the benefits of taking it. So that's one thing that kind of are tackling on a daily basis is that joint replacements, you do not have to take antibiotics before your dental appointment, except in maybe specific cases of somebody that's very compromised, or maybe they have an organ transplant, or maybe, they have severe diabetes and their health is uncontrolled. So there's sometimes we still will elect to, but in general, it is not recommended any longer. So that's one thing. Another would be, again, back to this getting your news from social media and attack on science, is that there's a lot of fads out there. Charcoal toothpaste, and I'm like the last one to know everything. So, charcoal toothpastes, oil pulling, where people use essential oils and swish in their mouth. I'm not saying they don't have, maybe some benefits for something, but there's no research that supports the use of so many of these things that are fads, and it's the the flavor of the week. I'm going to do this because everybody else is doing this, but there's no basis behind it. And so I want to remind people that research is research for a reason, and don't believe everything you hear. Certainly don't believe what you hear on Facebook or TikTok. Find the real facts, and get the real research and the real information before you just decide to do something. So
yeah, I think that's good. Any other myths out there that right off the top of your head that you can think of that's...
Oh, well, one, we all grew up doing it, don't rinse your toothpaste off. When you brush your teeth, just spit it out, Don't put water on your brush and brush your teeth with water. Don't take it, rinse, because you're just rinsing the toothpaste right back off in the fluoride, which is completely defeating the purpose. So we weren't ever taught that in dental school. It was just randomly, I had an epiphany, and I was like, why am I doing this? Like at home, like it doesn't make any sense. And so after that, I started recommending people don't do that. And then research came out, I wouldn't say research, but recommendations came out, supporting what I had
already been saying.
Yeah. So do not rinse your toothpaste off.
Very good. So for busy people, what are 2 to 3 daily habits that will give you the biggest improvement on oral health?
Brush and floss. I mean, that's a pretty easy one.
Yeah.
Right? Brush, floss, and avoid sugary drinks. If you do those 3 things, you're probably going to have pretty good oral health.
Yeah.
You can brush 100 times a day. If you're not flossing, you're not cleaning in between your teeth, and you're going to get cavities there. One thing doesn't make up for other things. So you still have to follow the recommendations and do what you need to do if you really want to have comprehensive oral health. The sugary drinks, I mean, I hope that is common sense, but so many of us still do it. I mean, not only for your teeth, but for your body. There's so many detrimental effects on other parts of the body in addition to the mouth. I mean, it's a simple, easy thing, to do that can make a huge impact in your oral health and your overall health. Those 3 simple.
3 simple. So what's the recommended, or what do you recommend? Is it 3 times a day, or is there a guideline on? I mean,
generally 2 times a day.
Okay.
In the morning, the most important time is before bed. If it's not one size fits all, though. That's a recommendation across the board. But say you're, again, an American or anybody, and you take a lot of medications, and those medications cause you to have dry mouth, and there's other factors that go into that. Well, you're going to have to probably be doing it more frequently, because you're more at risk of tooth decay in those situations. So twice a day for the most part, unless you have other compounding issues with dry mouth or other medical things that would
indicate that.
Yeah.
So For mothers, grandmothers that are out there listening, and they're starting to care for children, when do you recommend that, at what age do you start introducing brushing and flossing to children?
Yeah, well, February is Children's Dental Health Month. As soon as they get their first tooth, it needs to be brushed. So, they have the little finger rubber things. It's really all about getting them accustomed to doing it. But I tell people, it's kind of a joke, but it's really not. You only have to brush the teeth you want to keep. That's it. That's it. It's very simple. If you don't brush them, you won't get to keep them probably. So as soon as they get their first tooth, typically we recommend that they have their first dental visit by the time they're 2. By that age, they should have all of their primary or their baby teeth. And as much as it, is about checking to make sure that they don't have any, oral issues at that age, it's also about just, again, getting into the habit, getting them used to the environment. Coming in when mom or dad gets their teeth brushed, sitting in the corner, even if they're playing their video games or doing whatever, just being in the environment makes them more comfortable. So when it's their turn, a lot of times they're excited to be the one in the chair.
Oh, that's really good advice. Yeah. Bringing a child in while you're getting it. So, yeah. So, children's toothpaste, is there a difference? Like what's like the recommended, like fluoride. I know there's some training toothpaste and so forth. I've seen that out there. Yeah. I mean, they're fluoride, find one that has fluoride. The big thing is not using the quantity. You don't want them to swallow a bunch of toothpaste. So, and that's the concern with, when they're younger and they don't know to spit it out or whatever, and that's why they have the fluoride-free toothpastes. But you should really only need a grain of rice-sized amount of toothpaste on a toothbrush. You don't need to put a glob on it. If you're putting a glob on it, that's a problem. And they're probably going to swallow it. So you only need a grain of rice size. So as long as you're kind of sticking to that amount, use a fluoride toothpaste because, again, it's starting to strengthen their teeth, as they're doing this every day. So, I think that's important as much as brushing twice a day and just getting them used to things is making sure that the toothpaste you're using has fluoride. And then the other thing is that we see not infrequently, it's what's called baby bottle decay, where, the child is put to bed with a bottle of milk or a bottle of something because it's soothing to them, and it's really just a habit. It's not that they need it at certain ages. By the time they have their teeth, they don't need a bottle to fall asleep, probably, right? Right.
If they do, fine, warm water, put warm water in it. But going to sleep with a bottle of anything other than water by the time they have teeth will cause rampant tooth decay.
Wow. Okay. Yeah, I think that's good. That's good advice. What about toothbrush and replacing your toothbrush, right? How often is that recommended? How often do you recommend it? And what's the best practices?
I mean, it varies, but every few months. Okay. Most likely, but I mean, I don't replace mine as every 3 months.
Yeah.
You can, sterilize it put it in alcohol. The big thing, I guess, is when the bristles start to fray and things, then it's really not doing you much good at that point. It's not doing the work that it needs to do. So you're not getting ahead.
Yeah. All right. Well, great. How has digital dentistry changed patient care? Yeah.
I mean, there's so many advances with artificial intelligence. It really helps. You can see things that you weren't able to see before. You can do things that you weren't able to do before. Time, I mean, it does make things faster. So, for example, in our practice, if somebody is getting a crown or a cap made, we have a digital scanner. So instead of 99% of the time now we're not using the goopy impression material that they have to bite on for 5 minutes. We're scanning it in 30 seconds with a camera. And then that's artificial intelligence, and that goes digitally to the lab, and it's pretty much all done by AI now. So it gives you the opportunity to see things in 3 dimensions and really make sure everything's just the way you want it before you have that case made. So especially with surgical cases for the oral surgeons or the periodontists who are placing implants, they can see that bone in 3 dimensions before they ever touch the patient, and so they can make sure they're avoiding critical structures, nerves, and this, you don't want to put an implant in the sinus. That's not not a good idea. So with AI and with digital, they know exactly where they're at. They know what they're close to, and they can have a better outcome.
That's great. That's great. So, you in your practice, is there a time that you can share a memorable moment that that kind of has stuck with you throughout?
I mean, there have been. I think one of the biggest reasons that I went into dentistry is because you can see immediate results, and you can make an immediate difference in somebody's life. And so I guess one guy that I think back to frequently was when I practiced in Western Maryland, and he was a firefighter. I'd say he was in his 50s, but he didn't like his smile, so we ended up doing a lot of crown and bridge work across the front and partials. And so on the day we finished it up, he walked out. He had all of his new things in his mouth, and he looked great. And I walked out into the parking lot right after work, and he was sitting in his car crying.
Oh,
and
wow.
I'm thinking, oh crap. Like, is this good or is this bad? And so I walked over and I was like, are you okay? And I mean, they were tears of happiness. He was just saying he just couldn't believe what a difference it made, and he was just so happy that he had done that. So I think back to him.
Yeah.
Yeah.
That's great. So how do you approach treatment decisions when patients are worried about cost?
Well, as they say, an ounce of prevention is worth a pound of treatment, right? For every dollar spent on prevention, it saves around $20 on treatment. So that's I think the biggest thing is, maybe this having a fluoride application may sound frivolous and a waste of money, but you know what? This is shown to work into reducing cavities. This can save you a whole lot of money later on by preventing that cavity from ever starting. So I would say that is the biggest thing, is prevention. But they have to also remember, no treatment is also an option. And there's multiple ways that we can go about things. So we, I think, need to know what their concerns are. If we don't know that they're concerned about cost, we can't kind of tailor a plan to help them be able to get the treatment that they need, because they may not be able to afford it otherwise. So just having an open and honest conversation, I think, about where they're at and what their goals are will help us determine which direction we go. But no treatment is always an option, and there's always a range of things that you can do. And so just having those conversations in advance helps.
I think that's great. What public health change would most improve oral health outcomes?
That's easy. Again, eliminate sugary drinks, get them out of schools, get them out of, public places. It's has so many far-reaching, repercussions with diabetes, with obesity, with tooth decay. It's such an easy thing to choose something different than Coke or, a giant sweet tea or, whatever it is. It's an easy, cheap thing to change that would make an enormous difference in overall health.
What about, like, I know there's a lot of the energy drinks out there and so forth. Are you, and it feels and seems like there's an uptick and definitely an increase in consumption of that. Are you seeing that impact dentistry?
Yeah, I mean, a lot of, even if it says sugar-free on it, you have to look at what is being used to sweeten it. So, for example, Diet Coke, right? 0 calories, 0 sugar, right? But it all breaks down to the same products. There's acid in it. They use citric acid most times to sweeten the sugar-free beverages. And citric acid is just like lemon juice, or, it's a sweetener, but it has a pH that's very, very acidic. And so it's not any better to drink that as far as your teeth go than to drink the full sugar version, because the sugar breaks down to acid. The citric acid is already acid. So it has the same damaging effect on the teeth. And even, the energy drinks, the sports drinks, a lot of them are using these type of acids in their flavorings, even water. Propel, like there's a lot of just flavored waters, and people are like, they think, oh yeah, I'm drinking a lot of water. I'm not drinking this Mountain Dew now. Like, I'm doing good. But if you're not looking on the ingredients, if it's a water flavored with citric acid, it may not have the calories, but it's doing the same damage to your teeth as the Mountain Dew is, because it's the acid that's breaking down the enamel.
Yeah. So outside of, maybe being mindful of what you're consuming as far as the liquid go, and water really needs to be the main. Are there other, things that we can do nutrition wise that can impact our dental health overall?
I mean, I wouldn't say anything specific. I mean, okay. We all know, hey, we should eat a healthy diet. We should do this. We should do that. So I wouldn't say specifically, other than avoiding the junk, the sugary foods. But to kind of, I guess, segue into the one thing you can do is with the water, making sure it's fluoridated water. Yeah. That is the biggest, I think, thing you can do from the beginning to have better health later on.
Yeah.
Yeah. I mean, it's been something that's been controversial across the board, but it's, really, it's listed as one of the 10 best public health advances in history of this century. And there's a lot of reasons for that. So, again, with following the science and following, factual, reliable, credible information, fluoridated drinking water is one of the most important things that you can do from, the time you're a baby, when you're mixing formula or whatever, because that is forming harder teeth as they're growing and as they're forming in the jawbone. So they're becoming stronger from the inside out versus the topical fluorides in toothpastes or, that we apply at the office every 6 months, which are only working from the outside in. They can't do as much. So they're helping the surface, but they're not soaking into the tooth. So the fluoridated water is incredibly important. A lot of studies, especially recently, in the last few years, have shown that there's an increase in cognitive abilities in populations that were exposed to fluoride from an early age. So they're performing better in math in secondary school. I actually want to
you
tell
have
the
something
statistic.
You want to read to us?
So the study was called childhood fluoride exposure and cognition across the life course. That's what they were studying. And so they looked at almost 27,000 students from over 1,000 high schools across America. And they found that, there was robust evidence that young people who were exposed to typical recommended levels, which is what in the United States, 0.7 parts per million, in the drinking water, performed better on tests in mathematics, reading, and vocabulary than their peers that were never exposed to sufficient levels of fluoride. So not only is it forming harder teeth as they grow, but cognitively, the kids that were exposed to this are doing better in school. They have higher cognition.
Wow. I think that's probably, I mean, that's probably something that I think a lot, maybe people here listening today didn't know. And so that's a great takeaway from this podcast, for sure.
Yeah, and you know, there past research and past studies that found that there was a link between lower brain functioning and fluoride. We're looking at countries like China, India, and Iran, whose water fluoride was significantly higher than what we have, 2-3 times higher than what we have in the United States, actually at toxic levels. So at toxic levels, yes, they were having other issues, but that's not what we have in the United States. The optimal level here is 0.7 parts per million, and that level has been shown not only, again, with the better oral health, but with the higher cognitive functioning in the kids. So yeah, a lot of the studies that we're saying that got people worried were ones from these other countries that were putting toxic levels in their water, and that's not us.
That's not us.
No.
Yeah. Okay. Very good. So, what is one piece of advice that you would give to a dental student or a new grad?
Find a mentor. There's so many things. You know, they say that you learn 4 times as much about dentistry your first year out as you did in all the years of dental school, and it is true. So the learning doesn't stop just because you graduated and you got your degree. And for a lot of people, they're not confident in necessarily what their skills are, or sometimes they just need somebody to bounce ideas off of. Say, what would you do here? What would you do there? What do you think about this? But having a good mentor that can help you with those things and even bail you out if you need to be bailed out at times just increases confidence to where, maybe somebody coming out of school that didn't have a mentor says, oh, I don't do extractions. Like, I don't do that at all, because they never really learned how. They never developed that confidence. So having a good mentor really helps you to develop your skills and your confidence so that you can do general dentistry and be comfortable doing it, versus having to, streamline and narrow your scope just because you never really learned.
Yeah. Yeah. For you, who was that mentor, or were there multiple?
Yeah. Well, I was fortunate to have 2. My dad, of course, being one. He's somewhat of a dental genius. Maybe somewhat of a cowboy in certain aspects. But, even now, he's been practicing almost 50 years, and he still has, patients that are coming in with the same work that they had, 4 decades ago. So I've seen, the way he does things, it lasts. It goes a long way. So he was a great mentor, is a great mentor, still around. And then when I worked in Western Maryland, again, I was fortunate enough to have the owner of the practice was very much involved in continuing education and, pushing you to continue on and learn new things and improve. And so I was very lucky in that respect.
Yeah. So let's talk about you for just a minute.
No.
So, what are there daily habits that you have that you see as a person that set you up for success? Because you're running a business, you're a dentist, and so forth. So, do you mind sharing with our audience?
Tim Hortons. Have to have tea.
Have to have tea. Yeah.
And it's hot chocolate, Starbucks hot chocolates. That's my wine. So frequently I get that.
Hot chocolate and tea.
It's like, just give me 5 minutes. Let me go here, do my thing, and start the day off.
I love it. That's great. That's great.
Now I see you behind me in line very frequently,
you know,
Stephanie.
I'm guilty. I'm so guilty. Very good.
Kindred spirits.
And I know there's been a ice cap shared here and there.
Yeah, now and again.
Now and again. So, you know, I'll have to ask this. This is not something we talked about before, but how do you handle somebody that's genuinely terrified of coming in to sit in your chair? Because you know there might be somebody out there that can handle a lot, but sitting in the dentist chair just feels scary. Like, what are some of the things that you can give advice?
Sometimes the biggest challenge is just walking through the door, and most of the time the fear is irrational. It's unfounded, but what you tell yourself can be pretty powerful. The way you think about things can be pretty powerful. Again, I think walking through the door is sometimes the hardest thing, or picking up the phone and making the call is sometimes the hardest thing to do. But once you're in there, we can have a conversation. There are things that we can do. If it's the sound of the drills that bother you, we can do earplugs. We can bring your music, bring your headphones. If it's the light, we can block that the light out. If you're really anxious, there's medications we can prescribe to take the edge off, to make you comfortable. Because at the end of the day, by neglecting to come in, you're setting yourself up for scarier things down the road. Whereas, if we did something now, it might be a simple, straightforward, easy fix or easy procedure. 5 years from now, well, now you may be looking at extractions and, other things that would make you more, fearful. So, and a lot of times people realize after the first couple of visits, oh, it's not bad like I thought it was going to be. And then they start to feel much more comfortable. And there's a lot of people that, felt like they needed, oral sedatives and anxiety medicine that now they don't. They come in and they're smiling and they're not, have a death grip on the chair and, hyperventilating. And so it's just about repetition and, trying to talk yourself down off the ledge, because 9 times out of 10, it's not what you think it's going to be. It's much different than what you think it's going to be, generally. So just pick up the phone, make the call, walk in, tell us that you're nervous, let's talk about it, and there's a lot of things we can do to try to help.
Yeah, you're at your office. I've been in your office, and they do a nice job with that. So, you have a contest coming up. You have something for the community. Do you want to talk about that for just a minute?
Yeah.
Yeah, let's talk about that.
I don't even know if the clues have started running yet, but
not yet. But we're getting them up. But we'll give a little tease to it.
Yeah. Well,
sure.
There you go. So it's the golden tooth.
And what does that mean? What's a golden tooth?
Well, right. Many years ago. So my family's ancestry is Irish on one side, and so many years ago, my dad started this golden tooth, competition leading up to St. Patrick's Day, and so we hide something around the community. WTAP broadcasts clues each week, and people are able to try to follow the clues and go out into the community, into the parks, and try to find it. And it just goes week by week, and it gets people out of the house. As spring comes, it's as much about oral health as it is just overall health, getting some exercise, getting out in nature, getting out in the fresh air. But whoever finds the hidden tooth or the hidden key or whatever we are doing wins $1,000, and they win the pot of gold on St. Patrick's Day. So yeah.
Yeah, it's a fun promotion, and I know in the past we've had a lot of listeners out there that just have enjoyed getting out and getting active.
It is.
This time of year.
It's just fun. It's just something. It's light and fun, and you get a little money out of it.
and I think every once in a while you need that kind of that kind of fun in the wintertime.
Oh, yeah.
Yeah.
Absolutely.
So you're running a business. Let's talk about work-life balance. What
I don't have it.
You know what?
I could use a podcast on that as well.
You know what? We will do a podcast just on work-life balance.
I think that would be great.
So what do you do? What do you enjoy doing if you had the time, what would you enjoy doing? What are some of the things that you do?
Well, you and I hike together sometimes. So just getting outside, working outside, hiking. I love to run. I try to run or exercise as much as I can. I mean, that's kind of my go-to in my free time. I do that because it just, helps with anxiety, and it helps, just in general with everything. And I feel so much better when I'm able to consistently do that on so many levels. So that's the one thing that I always try to do if and when I have discretionary time.
I know, that's a big gift these days, right?
Yeah.
So, yeah, well, very good. Well, I want to thank you for coming on the podcast. But before we wrap up, is there anything that I maybe haven't asked that you just would love to share with our viewers, our audience right now?
I think you've done a great job of covering a lot of bases today.
Well, and I know that there's definitely an opportunity for us to come back together and maybe get a little granular on some of these topics. We talked about overall dental health, and so you may in the future there may be opportunities for us to work together and have a discussion about getting a little granular.
Yeah,
so
I think that would be great.
All right.
The mouth-body connection.
Yes, absolutely. Yeah. So. We're going to do a little rapid fire.
Okay.
Okay. So, all righty. Coffee or tea?
Tea.
Yeah, I knew that. Let's say ocean or mountains?
Oh, I thought the question was dessert.
I know. I wanted to throw you off.
I know. You know what? I'm going to go with ocean now.
Ocean
I'm going to
now.
go with ocean now. And I would even pick that over dessert at this point, because just the solitude of being able to be there and listen. We talked about the work-life balance thing. I'll take the relaxation over all the others at this point.
All right. How about the dessert? How about apple pie or chocolate cake?
Chocolate cake.
Chocolate cake. Yeah, me too. What is your favorite outdoor activity?
Hiking.
Running,
hiking.
Hiking.
Yep.
Yeah. Hiking? What's your favorite hike ever? Most memorable. You probably have many.
Probably a few years ago, we were at the Smoky Mountain National Park, and my sister and sister-in-law and my dad and I were hiking. Is Mount LeConte. It was the second highest peak in the Smokies, and so it's supposed to be a family thing. But my dad runs far ahead of us, and it's 7 miles to the top of the mountain.
And this is typical for him, right?
Yeah, I mean, we were supposed to stay together. It was supposed to be an enjoyable family, but it's all about pushing yourself, I guess. So we get to the top, and he's nowhere to be found. And of course, there's no cell phone service. So a big rainstorm was coming in, thunderstorm. And so it's getting dark. We don't know where he is, somewhere in the Smoky Mountains. We go back down, 7 miles back down, sitting in the car in the parking lot in the rain. There's no Wayne Dunn anywhere. And so finally, right when we were ready to call 911 and get the search parties out, we finally got a hold of my mom, and we got a hold of one of the visitor centers, that he was at a visitor center, a couple miles away from where we were, had taken the wrong trail, fallen, rolled. I mean, just. And I think he learned his lesson.
That was an adventurous weekend.
It was an adventurous weekend, yeah.
Yeah. Well, that sounds fun.
Yep.
So, do you have a book or a podcast that you listen to, that you follow, that you?
There is one. I wouldn't say book, but one of. I don't really. I like to read for pleasure. I don't really listen to podcasts a whole lot. Just timing.
Yeah.
But a friend from here, who's a professor in Pennsylvania now, sent me. It was J.K. Rowling's, who the Harry Potter author, she gave the commencement speech at Harvard in 2008. And so my friend Sarah sent this, I guess it wasn't even a podcast, it was the speech to me. And it was, the title of it was The Fringe Benefits of Failure. And, you're thinking, what does J.K. Rowling know about failure? But it was really on a depth. It really makes you think about life in a bigger picture and the really important things, and how you're viewing hardships and how you're viewing success, and just human nature and the power of empathy. And it was, I've probably listened to it 20 times over the years. I highly recommend it. So J.K. Rowling's Harvard 2008 commencement speech.
I definitely.
Fringe benefit of failure.
Yeah, I'm sure I need to listen to that
it's
for
good.
sure. Sir.
It's good.
Sir. If you weren't a dentist, what would you be doing?
Laying on the beach.
Laying on a beach. We're going to get you to the beach.
Right, we're gonna get, I would probably be doing something with environmental engineering, environmental protection type things. I would solar, renewable energy. Maybe I'd be a solar engineer. I don't know, but it's probably something in those.
Something along those
Yeah.
lines. Yeah. Well, very good. Well, again, I just want to tell you, just want to say thank you for coming on the podcast, and we'll come back together again.
Sounds great. Thanks for having me.
All right, thanks.